Hello, friends. How are you? Hope all of you are safe and taking good care of yourself. I am Kaushiki Dwivedee and I'm a infertility specialist and gynecologist in Gurgaon. I work as a freelancer. Today, I shall be talking about IVF or in vitro fertilization, which is the most advanced method of treatment available to treat infertile couples. In today's time, infertility is detected more often than before, and thus, 1 in 6 couples worldwide would need some sort of help, be it simple ovulation induction, be it IUI, or be it ultimately IVF. A couple is said to be infertile when they have been trying actively for at least 12 months, and despite that, the lady doesn't conceive. The incidence of infertility is 1 in 6 couples worldwide would need some help in conception. It is not as if infertility is on rise. It is just that people are more aware of the condition and thankfully they come for help much sooner as compared to before. There are various treatment options available for infertility. Sometimes, actually, no medical intervention is needed. What a couple needs is just a timely advice or just to tell them how to calculate their most fertile period. But when that doesn't help, in that case, we have options like ovulation induction, where medication is given orally to make the lady produce eggs, or we can offer an intrauterine insemination, which is a procedure which is much less invasive than IVF, but of course it has a lesser success rate in comparison to IVF, and ultimately IVF, which is also called in vitro fertilization. What is in vitro fertilization? Let's first understand what is fertilization. Whenever female and male gametes, which are called egg and sperm, they meet, they produce what is called an embryo, and that happens by a process which is called fertilization. Now, the fertilization usually is in vivo. That means anything which is happening inside the body is called in vivo, and whatever happens outside the body, that is called in vitro. So in vitro fertilization, the process of fertilization, that is making the embryo by bringing the ovum and the sperm, happens outside the human body, which is in the IVF lab, and that is why it is also called test tube babies. In IVF, it is important to have a good counseling of both the partners with their infertility specialist, because it is a long, tedious process which needs a lot of emotional support of the doctor as well as of the couples themselves. So it is always helpful to plan the IVF cycles and meet your infertility specialist well in advance, at least a month in advance, so that you can put your questions across and come to know all your answers and get the answers to all your queries. Once you have decided to undergo an IVF cycle, your infertility specialist will advise investigations for both the partners, which is basically to check the suitability for IVF and also to see which protocol will work best for you. On day 2nd of the periods, a baseline ultrasound scan and blood work is done, following which 10 to 12 days of hormonal injections are prescribed to the lady. These injections are administered in the fat of the lady, and after learning the technique, she can herself do so at home. She would need to visit the doctor though to get herself monitored. Given an optimal dose based on the ovarian reserve and other considerations of the lady, the hormones are quite safe. The mild effects during the stimulation can be mood swing, bloatedness, heaviness in the lower abdomen, breast tenderness. If not monitored properly, on rare occasion, it can cause serious ovarian hyperstimulation syndrome. From day 6th onwards, the lady is advised to visit the office of the specialist for an ultrasound scan, which is called follicular monitoring. What is the purpose of follicular monitoring in IVF? Follicular monitoring is done to note the response of the ovaries to the hormones which are being administered. It is taken care of that the stimulation should not be so much that it causes a dreaded complication of IVF, which is called ovarian hyperstimulation syndrome. It also helps us in deciding when the lady is ready for an injection, which is called trigger. When at least 3 or more follicles reach the size of 15 to 18 millimeters or slightly more, then an injection is administered, which is called trigger. The purpose of the trigger is to mature the eggs developing in the follicles. After 34 to 36 hours of this injection, the process of ovum pickup or ovum harvesting takes place. After 34 to 36 hours of the trigger, under short general anesthesia, the procedure of ovum pickup or ovum harvesting is done in the operation theatre. It involves an ultrasound guided needle to be introduced vaginally in the ovaries and suck out the follicular fluid. These follicular fluids is supposed to contain the eggs, which are examined by the embryologist to confirm after the ovum pickup. After the ovum pickup, the eggs are mixed with the sperm in the IVF lab. Here comes the very important role of embryologist. Under the care of the embryologist, the embryos develop in the IVF lab and they are examined by them on a daily basis till day 3 or day 5, when it is decided that how suitable they are for an embryo transfer. The day 5 embryo is called blastocyst, and that is considered the most superior quality of embryo. As mentioned earlier, depending upon the growth of the embryo, whether it reaches day 3 or day 5, an embryo transfer is planned, and the day of the embryo transfer is conveyed to the lady by the gynecologist involved. Usually, embryo transfer is a procedure which is very less invasive and similar to pap smear. It is done in the outpatient department and it doesn't involve much pain or discomfort. Embryo transfer. The embryos are put in the uterus of the mother under ultrasound guidance. If there are surplus embryos picked up or formed in a particular IVF cycle, then they can be frozen in the IVF lab by a procedure which is called cryopreservation. The cryopreserved eggs can be thawed or defrozen at a later date if needed to be used for embryo transfer, and that is called frozen embryo transfer. The advantage of cryopreservation is that if the lady is lucky enough to have surplus embryos, then in forthcoming cycles she would not need to take hormones once again, and these embryos can be used instead. Not a mandatory procedure associated with a regular IVF cycle, but it is recommended to get pre-implantation genetic testing. The advantage of pre-implantation genetic testing is that we know beforehand that of all the blastocysts which are produced, which one are the chromosomally normal ones, because not all blastocysts are normal and not all of them are going to give healthy live baby. So pre-implantation genetic testing helps us in determining before implantation which are the healthy embryos. Following an embryo transfer, the coming 2 weeks are called luteal phase, and that is the time when implantation takes place. In the luteal phase, hormones are administered to support the pregnancy if in case the implantation takes place. It might involve having injectable or non-injectable or a combination of injectable and non-injectable medication for those 15 days till you do your pregnancy test. After 15 days of the embryo transfer, it is recommended to get your blood test to confirm pregnancy. The success rate of IVF, which is the take-home baby rate, is 30 to 35%, which is reasonable, but it is not like 100% of the couple who go for IVF will have a baby in the very first cycle. The reason I am stressing on this particular point is because when the couple come for IVF, they by default assume that they will be in that 35%, but by the law of probability, one can assume the chances of being in 70% is or 65% is more than that being in 35%. And it is important to have a reasonable expectation from a particular treatment. That way, we prevent ourselves from getting demoralized if in case few cycles fail, and unless we try, success will never touch us. I hope you found this video helpful in understanding the basics of IVF or in vitro fertilization. All of you have a nice day ahead.